Carpal tunnel syndrome can cause long-lasting nerve damage if it's not treated quickly. I'm going to show you guys efficient and quick ways to treat carpal tunnel conservatively and other options as well. Carpal tunnel syndrome is characterized by compression of the median nerve in the carpal tunnel area. And the median nerve is one of the largest nerves in your arm. It starts up at the neck, it goes down through your arm, down to past your forearm, past the wrist, and into your first three fingers and half of the fourth finger. And it's common to feel numbness and tingling, decreased sensation throughout that area, especially the fingers. And also you might experience weakness, decreased grip strength, and difficulty using your fingers. Here are some of the top exercises to treat carpal tunnel syndrome. The first is a median nerve slider. Essentially, we're going to floss around the nerves, get more movement, increase the blood flow around the median nerve. And to do this, you're going to use your neck to turn to the side of the affected arm or the painful arm. And you're just going to bring your arm out just like that. And I want you to follow your arm with your head just like that. And the more you extend at your wrist, the more you'll feel tension at the nerve. Or even if you turn your head in the opposite direction, you'll feel more tension as the median nerve begins around the neck. So essentially, we're just gently easing into it and we're going back and forth. You just want to ease it and you don't want to push too hard into the pain because you'll make the nerves angry. And it's okay if you don't go this far. If that's too sensitive, you can even just take your arm and just go back and forth just like that. And as you get more comfortable, you can push more. And the next level would actually be going in the opposite direction. So essentially you're turning your neck in the opposite direction. And that creates more tension in the nerve distribution. It's kind of like a spaghetti noodle. And you just pull one side and the other side moves as well. Next exercise, we're going to bring your arm out here in about a 90-degree position. And we're just going to bring the fingers in and out like that. That's going to create more blood flow along the wrist as well. And you can just do this for about 30 seconds and then relax. And you don't want to do it too much if it's causing an increase in your symptoms. You just want to do it right before you feel an increase in discomfort and then back off of it. Next, we're just going to do a tendon glide to get more movement and blood flow throughout our joints. This is the first one. It's at the metacarpal joint. And the next one, we're just going to bend just like that. So we're going to bend our inner phalangeal joints. And you can just do that about 10 to 15 times. Just don't push too hard if you feel discomfort. I recommend you do these exercises and even get a night splint brace to put on your wrist. It is great if the pain wakes you up at night. And with this, you can go to sleep in peace. It puts your wrist in a neutral position so we don't bend and extend it, which can aggravate the symptoms at the median nerve. And last resort, if you need surgery, if your symptoms are not getting better, consult with a surgeon and they may consider doing a carpal tunnel release, where essentially they just remove a ligament called the transverse carpal ligament at the wrist to remove the compression at the median nerve. That's all for today. If the video was helpful or if you have any other tips for carpal tunnel syndrome, make sure to post in the comments and watch this next video to improve your mobility.